let's talk about breathing and hypermobility breathing, which is what this video is all about. When it comes to breathing, there are a lot of different ways to breathe. The one that I share with my patients is what I refer to as hypermobile breathing. It's the same kind of breathing as I refer to as biological breathing, which is the kind of breathing that we learn by watching babies and infants do. So we're fully capable of breathing different ways. And you can hold your breath for so many seconds, or breathe in for so many seconds, hold it for so many seconds, and breathe out for so many seconds. Those are all variations of your breathing, but the one that I'm referring you to is the one that we automatically do as babies. So the way my line of thinking is that if we're doing it that way automatically, and we do that for a good 3 years, if not a little bit more, before we start altering it due to our lifestyle options and choices and activities, then that must be the right type of breathing for stabilization and for our movement and balancing. In my practice, when it comes to my non-hypermobile patients, I refer to this as biological breathing. The only difference between that and my hypermobile breathing is the cueing. So let me explain to you. You're going to breathe through your nose, and then you have your vocal diaphragm, thoracic diaphragm, and your pelvic diaphragm being stacked on top of each other and parallel to the ground. So as you breathe in, your vocal diaphragm goes down. That fills up your lungs, which in turn will get to the thoracic diaphragm and push the thoracic diaphragm down. Now that increases your inner abdominal pressure, and that inner abdominal pressure pushes on the pelvic diaphragm, and the pelvic diaphragm relaxes. In the process of breathing out, it is the contraction of the pelvic muscles, that's the floor and the walls that are connected, kind of like fingers going to each other. They all contract. That pressure increases your inner pelvic pressure, and then you reverse the process. So there's an increase in inner thoracic pressure, then increase in an inner abdominal pressure, and then inner pelvic pressure. Now, when it comes to breathing, you need to, and what I recommend my patients is to visualize this abdominal diaphragm going down the tube as you're breathing in. This is a little bit difficult, so my suggestion is for you to lay down on the floor with your knees bent and practice that. So you're laying down on the floor just like I'm about to do. Your neck is elongated and you close the gap in the small of your back. Your pelvis is brought up, so you're tilting your pelvis up to assist in closing that gap. You're elongating your head as you're practicing the breathing. So you're breathing through your nose and you're seeing this the thoracic diaphragm going down the tube. That's a very difficult, not difficult, but different way of breathing. But it's so important because it assists the anatomy to follow the physiology and the movement, the biomechanics of your body parts in the process of breathing. So you're breathing in, thinking about the diaphragm going down the tube. At the same time, I want you to think about your rib cage on the sides expanding out. So we're breathing in, the diaphragm goes down the tube and your sides expand. So in the process of breathing in, you have a circumferential expansion of your thorax and your torso. And in the process of breathing out, you have an elongation of those muscles. Now, the reason this is super important is because this type of breathing will stimulate, will activate, will strengthen the muscles of your trunk, which allow you for better stability. When you have better stability of your trunk, you have less chance of wobbliness and shakiness as you're standing up, or more importantly, as you walk, which we all know that when it comes to the bendy population, ankle stability is quite often compromised. So we want to stabilize as much as possible on the structures above for better and safer way to proceed with our movements. Now, when you're breathing in, you're increasing your interthoracic, this area, pressure. So think about you're breathing in, you're sending this down, and think about your armpits, like where I'm pointing here, expanding out. That inner thoracic pressure being increased actually stimulates also your vagus nerve, which assists you with heartbeat, increased heartbeat. So this becomes a tool, so when you're having tachycardia, you can utilize that component of this breathing instruction to deal with the increased heartbeat, which obviously can easily lead into other problems like anxiety. So this is the way to breathe in and to breathe out. If you have any questions, make sure you use one of the methods of contact in the description box to contact us, and make sure to subscribe to this channel because this is all about hypermobility.